Hi everyone, my name is Alicia and this presentation is on African Americans with chronic heart failure and decreasing readmission rates to the hospital. According to the American Heart Association, heart failure is a chronic progressive condition in which the heart muscle is unable to pump enough blood through to meet the body's needs for blood and oxygen. Heart failure occurs when the stress of other health conditions either damages the heart or causes it to overwork. Some of these conditions include coronary artery disease, which is when cholesterol builds up in the arteries of the heart, high blood pressure, and previous history of heart attack. Lifestyle factors that can contribute to heart failure are inactivity, being overweight, eating a diet high in fat and cholesterol, and smoking. African Americans have the highest risk of developing heart failure compared to other ethnic groups in the United States. This may be due to an increased prevalence of obesity, hypertension, and diabetes. And African Americans are also hospitalized 7 to 8 times more often than Caucasians due to heart failure exacerbation. They also tend to have more frequent hospital visits, longer hospital stays, and higher health care costs. They are also more likely to die from complications of heart failure compared to other racial groups. To assess learning needs of the group, I would suggest each participant take a survey prior to a discussion or presentation on the topic to identify what they already know about heart failure and where there are areas of knowledge deficit. They can also answer questions about barriers they experience or may perceive that prevent them from appropriately managing their heart failure. It is also important to promote a comfortable, non-judgmental environment. This will help encourage them to ask questions and express concerns freely. The health promotion model I chose to guide the teaching plan is the Precede Proceed model. The Precede step has 4 phases. The first is social and community assessment. While heart failure has already been identified as the main health problem for this group, further assessment helps to identify the strengths, weaknesses, and resources available to the community, as well as their readiness to change. The second phase is an epidemiological assessment, which focuses on specific health issues of the target community, analysis of behavioral goals or problems, and identification of environmental factors that may impact behavior. Environmental factors for this community include unavailability of healthy and affordable foods and overabundance of unhealthy and cheap fast food. There may also be limited access to doctors and clinics, as well as limited access to culturally sensitive or congruent health care. Phase 3 is an educational and ecological assessment of predisposing, enabling, and reinforcing factors that will help initiate and contribute to goal behavior. Continued social support for this community has shown to improve adherence to self-management interventions. Phase 4 is administration and policy assessment, which identifies resources and coordinates programs to assist the community with attaining goals. Proceed also has 4 phases. Phase 5 is implementation of proposed interventions for both individuals and the community. And phases 6 through 8 focus on evaluation of the proposed interventions. Evaluation helps determine which interventions are effective and which are ineffective, and adjustments are required for ineffective interventions. I selected this model because it focuses on both the individual and the community and identifies how the social and physical environment impacts both. It also helps to identify specific barriers and provide a structure to create and implement the most appropriate interventions for the target community. The goal for the health education plan is for the group to verbalize signs and symptoms of heart failure and understanding of self-management interventions. Signs and symptoms of worsening heart failure include swelling, weight gain, increasing fatigue, dizziness or fainting, worsening shortness of breath with or without activity, rapid heart rate, and palpitations. Self-management interventions include monitoring weight, restricting salt in their diet and possibly fluids as well, exercise, adherence to medication regimen, smoking cessation, and importance of following up with their doctor. The first behavior outcome is for group members to maintain a consistent weight through diet, exercise, and adherence to the medication regimen. A diary may be helpful to obtain this outcome, as group members can write down their daily weights, keep track of their sodium and fluid intake, stay on top of working out, and set a schedule for taking medication. The second outcome is for group members to regularly attend appointments with their doctor to follow up on continued heart failure management. Ensuring that patients keep track of their appointments, have access to a local doctor, and have a support system will encourage them to continue attending appointments. The third outcome is that group members will be able to identify new and continued barriers to management of their heart failure. These barriers can be identified as patients utilize their self-management interventions, and they should follow up with their healthcare team to address these barriers and adjust or create new interventions to help overcome them. There are many factors that contribute to the higher incidence of hospital readmission rates for African Americans. A limited understanding of the disease and recognition of signs and symptoms make it difficult to connect management of heart failure to improving health. And a lack of culturally congruent care can directly impact management interventions. Patients diagnosed with heart failure are taught to limit salt intake, but not necessarily what can be used as an appropriate substitute. Doctors who aren't familiar with the culture may not be aware that African Americans cook meals with a lot of salt and would only tell them to limit salt, but may not suggest other spices or herbs that can be substituted instead. There's also an inadequate or lack of insurance for many African Americans, and it can be a major barrier as diagnosis of heart failure might be delayed and may also go untreated. Poverty is another barrier as it increases stress, which in turn affects blood pressure and therefore the heart. It also prevents access to quality healthcare and healthy foods for continued management of heart failure. Depression has also been identified as a reason for not taking medications, following a healthy diet, and participating in daily exercise. And finally, decreased adherence to medication regimen can be linked to affordability of the medications as well as a lack of trust in the healthcare system. Evaluations are done to determine the effectiveness of the health education plan. A short-term evaluation would be to implement the teach-back method to have the group describe how they will use the information they were taught. This method allows for the assessment of their understanding and identifies gaps in their knowledge. A long-term evaluation would be to do a 30-day follow-up to assess the effectiveness of self-management interventions. This can be used to help the group adjust or come up with new interventions that may work better for them. In conclusion, the way forward to improve self-management for heart failure and to decrease readmission rates is to provide the community with more access to affordable healthcare and programs that will support them. There also needs to be more access to providers who are culturally competent. These providers should be aware that some African Americans may distrust the healthcare system, and they should allow them to share their concerns and fears comfortably. They should also attempt to build the trusting doctor-patient relationship by providing a non-judgmental, open, and understanding environment.